Now we want to make sure that we open up your hips and knees as best as possible and get them warm. One of the first things we can do is just an isometric lunge, where we will set our PVC down on the floor. Whichever leg you prefer to start with is fine. You're going to take a deep, deep lunge position, hands down on the inside of that front foot, driving the hip down into the floor, keeping the back knee off the ground, and pulling your chest up the entire time. From this position, we can rotate at the ankle and at the hip and at the knee. And another great thing to do is push this front knee out to the side away from you to open up the hip even further. For those of you that are feeling ambitious, you can try to drop the elbow to the floor or put your hand even underneath your leg and pull your hip further or closer to the front heel. Switch it up. The next thing we're going to do is just some basic squatting. Squatting can be surprisingly challenging when you hit a full depth, when you get the hip crease below the knee. So one of the ways I tell people to start is by using something like a door frame, doorknobs, any kind of post that you can hang on to in your house. The idea with squat is to make sure that the torso stays upright and that we don't get on our toes, which can be difficult. So one of the things I like to do is just grab onto the door frame. In this case, we're going to use this pull-up bar post. We're going to push the hips back, drop until we're completely at full depth, pulling our chest up, and we're going to hold the position for upwards of 10 minutes if we eventually get to that point. For new people getting into this for the first time, start with 1 minute. Go to 2 minutes after a week. Go to 3 minutes, 4 minutes. What we tell people is when you can sit down there and eat your dinner without any assistance, you've gotten to a good place. It'll look like this. You can even work through this range of motion a couple times and turn it into repetitions. Notice that my feet stay whole-footed on the floor. I never rock forward on my toes. From the front of the position, we want to make sure that the knee and the toe are tracking in the same direction. As we descend into the squat, a common tendency, especially for people who have an imbalance in their groin and their hip, is that the knees will collapse in and it'll look like this. And that puts a lot of unwanted force on the outside. What we can do is continue to push through the hip, out on the leg, and make sure that the knee and the toe are tracking. Start with that, and after a couple weeks, your hips should feel a lot better.